this afternoon, and it looks like we've worn a lot of people out. This has been a very heavily contented day. I know I've learned a lot out of today. We're going to talk a little bit, and I hope you will join us in this discussion about where do we go from here, because a one-day discussion of having a partnership with law enforcement isn't going to cut it, right? And I know many of you are already working on this, and I heard a number of your comments earlier about what you've learned that's going to help you in developing your partnerships going forward. I'm going to be working with, okay, I'm losing her name, our judicial counsel, Karen Moen. I knew the last name Moen, but I kept thinking Janice, Karen Moen. I'm going to be working with her, and we're going to talk some more about how we might continue some of these efforts to bring mental health, substance use disorders, and law enforcement together, working in partnership. So we'll be looking at a number of ways that we can do that. So I'm going to turn to our panel and ask you what you've thought about, whether you have ideas about what we should do in the future. If you would share those, and then I'm going to ask the audience to make some comments as well.
Okay, I'll start off. It was interesting when the courts were talking about locally designed systems for collaboration. So essentially, it's really about what we do locally with law enforcement, criminal justice, and how we interact with them. And from the different panel discussions that we've had today and discussions with other folks in the room that I've had, a lot of that work is already being done and is in process. It's probably not as formalized as what the court is viewing, but I have monthly meetings with our presiding judge, and that includes mental health, drug and alcohol, CPS, probation, and we discuss basically systems issues. We don't get into individual cases because we can't go there. But the systems are already being discussed to a certain extent. Now, it may be broadened with the DA and the public defender, which might give us a little different flavor to it, and the sheriff and also the local police. But we also have that happening locally in the AB 109 arena. So I think there's a lot of expansion of services that would be nice to have. The question for me is getting the resources in order to do that. One area that may be coming available is the MIOCA grants. And that would certainly help on the service side to provide some alternatives for some of the individuals with mental illness who are also going through our court system. So, the other side of it is drug court in one of the counties I work with. I have two counties, so I have Yuba County and Sutter County, has been in existence for almost 20 years. And for a rural county, that was fairly early start. But so there's different. Also, there's going to be, for me personally, there's going to be different system collaborations between the two counties, because one county works one way and another county works another way, and it's not right or wrong. It's what works best for their systems and their resources. And so I think that really is going to be a very locally defined systems change, and will require all of us to sort of think about how we do things with our law enforcement justice system partners, and to do our best to provide individual services to our clients who are also going through the justice system. So that's sort of what I got out of the day. And other than that, probably more on the sharing of how counties are doing their systems changes with the justice system on an ongoing basis, I think it'd be something to come back and revisit as what changes people have seen over a year or something along those lines. So that's sort of what I got out of the day.
Great, thank you.
Good afternoon, everybody. Thank you for sticking around. I know you're probably tempted to hit your rooms or go relax somewhere. I'll be brief. You could all line up over here and bring your pen with you so that you can sign on in support of the 5 recommendations that I mentioned this morning. And we'll have a lot to do with that going forward. I do believe that some of those things that were covered are, in fact, items that we will be working on ongoing, not necessarily related today, but they certainly dovetail with much of today's agenda. A couple other things that I think really have to be addressed, and I was thinking about them as we were listening today. You know, that group of folks that end up getting released from the prisons, the jails that really have no tail connected with them when they're released, are still in need of many of the services that we provide. The problem, of course, is a lot of the resources don't follow them because they don't have those tails. And for those that do, one of the crazy things with the realigned population 109, that might access treatment initially, or might access treatment sometime after they're on the streets, who get released from probation or parole, and suddenly whatever support they had, funding support for their care they had, abruptly ends. There's rarely any notification to the treatment provider. It just sort of happens, so there's no real planning for where does this person go next as a result, and it is sort of a messy situation that I think needs to be fixed. And as Judge Manley was talking about the collaboration courts and the drug courts and the populations that he sees and is working with every day, he talked a lot about the medication issue and the importance of making sure folks got the medications that they needed when they needed them and for as long as they needed them. And that was great to hear. And one of the things that I think remains still very problematic, both for the prisons, the jails, and for a lot of the courts, is their failure to recognize the need for a lot of the addiction medications. There's a need to get the formularies straightened out and a need to get those medications readily available in those settings. They, in fact, have very good outcomes, but they are frowned upon still in many ways. If you talk about methadone often in criminal justice or in the prisons, forget it, you can't get it. And we heard about, you know, they're not sterile environments, the prisons or the jails. 16% was being reported in terms of those being tested at the time of release, which I think is a great thing to be doing. I'd like to see more of that testing when folks are released, because there's so much denial about, I don't need any help, just so they can go on their way. And if you could hold them to task with a dirty test, I think more of them might rethink that thinking. So I think we have to find a way to be able to offer these medications while they're in custody and then link them appropriately to providers that can continue those medications when they're out, if we want to really do something about recidivism. Thank you.
Okay. Well, talk about that barbecue restaurant right about now. Or that good dad thing. And I do have Girl Scout cookies in the trunk of my car, just as evidence of this good dad thing. That when I asked to write that bio, it says, what kind of awards? And I thought, I'm not sure if I've ever gotten an award. And then I saw that thing on my desk there that my daughter had gave me, so I'm glad I put that on there, because that was probably the most important award. Yeah. So Boy, all the stuff it's amazing what we do compress into one day, and all the different thoughts and ideas that kind of, for me, that go through my head, and seeing things that I haven't heard of or haven't thought of. And then going back to some of the basic things, when I think of the gal I told you about, her name was Patty, and I think about, I wanted to start there and kind of end there on what did she need to do better. And that is for us to talk to each other and collaborate. We use all those words, to integrate, to collaborate, and all those kind of things. And then we don't do some of those most basic things that staff that are working on the cases. And as I looked into more to that, because that was troubling to me for quite some time and looked at it, and what I realized was that each one of these people that were saying, do this by this time, it just happened to kind of all hit on the same day, that it wasn't planned that way. But each one of them needed to get something on paper. Each one of them came from a place of power and control, and that's kind of how some of our systems are built. The issue of that, how it wasn't how it was going to affect this gal's life, as so much as I am judged on my paperwork being done on time. And, God knows that we're probably not going to get out of that. But I think as we work together and we think about what working together means, and how do we put that into the lives of our clients, because I think it's rather difficult for staff that haven't walked that road or are not a peer or lived experience, whatever words we want to use, is to actually put themselves in that client's experience and how they navigate. For a lot of it, and these were clients that were in they were in CalWorks perinatal program, so they knew systems. In fact, they could navigate systems quite well, better than I could ever do it. I mean, I have still never understood the CalWorks system, and these gals used to explain it to me. They knew exactly how to do it and how to get on the different systems within those. So that was the message, that I came with and I wanted to leave with. But then also, as the day went on, is one of my thoughts were, geez, I wonder who our presiding judge is. I had no idea. So I looked on the internet, Googled it, okay, called my assistant, said, hey, give me a meet and greet with our presiding judge. So obviously, that's important. Most people aren't as new as I am to a place. But and then that new law. It seems like those have been a lot of things we've been wanting and not getting, and now how to be careful what we ask for, type of thing, because what they're going to want us to do, maybe. That was a little bit of fear, but obviously I think that's a good inroad for us. And that idea of making them known of our services was kind of a neat idea. But then for me, the last presentation we sat in, the afternoon, was about the peer respite. And I thought, what an interesting concept about that. And it sounded to me, in listening to the panel members, that part of the reason it was working was it, again, was run by peers, of someone that has just walked that road, and someone that is not giving advice, but is sharing kind of some of that old 12-step language, I'm not going to tell you what to do, but here's what I did. And that kind of philosophy is one person reaching down to help another. Because I have seen the magic of when peers work with peers. No different than, I think, as parents, and we talk to people, you never get parental advice from a single person. Because they always have the answers, and they always tell you what you need to do. And I probably did that too. But we always want to seek out another parent who has a teenager that they're challenged with. And I think it's that same thing, that we want to work with someone, or we want to talk with someone who has the insight that a person who has that lived experience. So anyway, that's what I got out of the day.
That's great.
Thanks, Sandra.
Thank you. So we're going to be looking for more resources. I just want to point out that what you're seeing on the screen is an e-learning module developed by the Judicial Council around the development of a mental health and other collaborative courts. That will be available on our website starting next week. So I hope it is useful. I've looked at it. I thought it was incredibly helpful, very pragmatic, kind of practical ideas. And then we're going to be looking for other resources. What else can we find that's going to be helpful to you all? And I will also be sending out a survey because I want to hear from you what you think would be helpful. If there's something that CiMH could do, or actually we're going to have a new name after next week. I don't know what it is yet. But if there's something that you think of that we could be helpful, that you could use, we'll attempt to do that. So now I want to kind of open it up to you all. What are you thinking about after spending the day listening to all this information about partnerships with law enforcement? I tell you, I was very impressed with everyone who presented today. I kept thinking, boy, if I was running a county, I would want each one of those people in my county. They're perfect. But what are you thinking? Anybody willing to share? Alice has got the microphone here. We'd love to hear what your thoughts are.
It's on. Okay. I just wanted to say that this is one of the best policy forums I've been to in a long, long time in terms of meatiness and just that there was new information, and especially the information that came from the judging side. It's sort of like that world is something that they don't always necessarily share with us, and to kind of learn that this independently, I mean, I don't think there was a lot of advocacy on the part of mental health folks to get them to, change how they were doing as much as it was, what they were willing to do, maybe based on what they were seeing. And so I was just really glad to hear about those developments. And I feel optimistic. I think we've been given some tools to be able to move ahead in our counties.
Great. Thanks, Christy. Anybody else? Share your thoughts with us. It may be just exhausting at this point of the day. Hard to think new and creative thoughts, but Tom, you give us a shot.
I just wanted to echo Christy's comments. I was just filling out the evaluation and thinking, why is it that it feels like it was so useful and kind of one of the very best? And I think it's a combination that for me, the information was so germane to a lot of my responsibilities. But also, I think it's the kind of information that's really hard to get anywhere else. Particularly what came from the judges and probation. It was really special, and to hear what they're thinking as cutting edge, which then is really important to alert us about how we can then dovetail with it. So I feel inspired. I got new ideas for things I can do and things I can ask for, and it was really great.
Good. And I will share with you, too, it was the Judicial Council that came to us to say we want to do this with you. So they really had strong motivation. Anybody else have any thoughts? Oh, over
Hi,
here.
Madeline
Hi, Madeline.
Schlepfer with Stanislaus County. I just want to thank you for having individuals with lived experience on the panels and able to give us that piece of insight, because I really appreciated that.
Oh, good. Yeah, I can get lost in the numbers. It's always important for me to bring it back to real people. That's what it's all about. Looks like we've got someone back here. Great, thanks.
Sandra, you ready for me?
We're ready for you, Bill.
Okay. First.
By the way, there's a song, Don't Mess with Bill. It's
okay.
about Bill.
Bill Arroyo. Anyway, it's been fabulous, Sandra. Kudos to you and the team, Ellis and others who have helped put this together, because it's really been wonderful. And the best is yet to come. That's tomorrow, right? But that being said, I think what is missing that is critical in this is a discussion of dollars. And it's an important discussion because money makes the world go round in all of our worlds. And I think what we are missing is rigorous studies of cost-benefit analyses. I just learned yesterday, for those of you who don't know, I am a member of the California Rehabilitation Oversight Board, which is a board that reports to the state legislature related to rehabilitation services in the state prisons. Well, what I learned yesterday is that there is a unit within CDCR called the Board of State Community Corrections that is developed an expanded interest in conducting research. I think that there are a lot of strategies that communities in California are using for the treatment of people who are offenders and have co-occurring disorders or mental health and substance abuse. And if we could subject some of our efforts to a rigorous cost-benefit analysis, I think that that would speak quite a bit to the state legislature. And so that I challenge those of you who are doing a lot of this great work to partner with such groups like the BSCC or others, as has been done in the state of Washington, the Washington State Institute for Public Policy, that in fact has published cost-benefit analyses to a lot of evidence-based practices.
Right.
And they did so at the direction of the state legislature. And the rigor with which they did that is incomparable. No other entity in the U.S. has done work like that, and I think we need to do something like that so that our stories are even more compelling than they currently are.
Those are great ideas. I appreciate that. So, and the other question, the other issue you raised too is the discussion about budget. So that's something we can probably do some investigation and follow up on your other ideas. I think those are really great. Thank you.
I would agree that we need to think about strategies, given the fact that we have a limited budget now, and to try and get the legislature to be thinking about giving us, all of us, more money. You know, we've had a crisis the last few years, so I think we have to think about different strategies. And I was talking to, I think it's Dean True from Shasta County. I don't know if he's here, but I know that having sat in San Francisco and sat on this commission here, the task force for the Administrative Office of the Courts, that many of the rural counties have issues such as insufficient amount of resources, and they're all fighting for the same pot of money. And from some perspective of some of the rural counties, it's just crumbs with respect to AB 109 money and so on and so forth, which is part of the realignment money. One of the things I'm going to throw out for all of you to think about is to see whether, because I know the courts in some of the rural counties share expert witnesses, forensic evaluators for competency cases, that sort of thing, that I know when you go for the money, it's sort of a siloed approach. Every one of the 58 counties has that kind of concern. But perhaps in developing a comprehensive mental health court, folks can start thinking about perhaps getting the different county courts, the judges together, and the different departments of public health or mental health or however you have them set up together to see if you can pool your resources so that you have one set of people that can assist with this kind of court. It's just one idea because I know that the counties it's tough. I also understand the expense of trying to get someone to have people from one end of the state to the other. Up north in Northern California, you've got Laston and County and Shasta County, Trinity County. You've got counties where you got people driving all over the place. It's the same individuals. Why not share the cost of that? So that's something you need to think about.
Right. Thank you. Another very, very good suggestion. Any other thoughts people want to share?
I'm from the Administrative Office of the Courts, and first of all, I'd just like to say on developing this model health court, I wish we had developed it. It was actually developed by the Council of State Governments, but we share it.
Thank you.
We share it with absolutely everyone that we can. It's actually very well done. I'd like to thank you all for having made the combination of mental health, substance abuse, and the criminal justice system, bringing the three worlds together as a focus today, and for the warm welcome you have given all of our folks who joined us today. And I'd also like to thank the California Association of Mental Health Directors, and of course CiMH, for their support and their attention to this matter, because it does judges and the court no good to be interested in this, and a lot of their commitment to this work comes out of seeing the same problems before them time after time after time after time, and saying, can't we do something different? And so I really applaud your efforts. We're delighted to be part of this. I wish I could say that every court, every judge in the state would feel the same way. But I think that together we can find ways to make a difference that will truly improve the quality of justice for all.
Thank you, Karen. Really appreciate that. Another comment up here.
Hi, Barbara White with the City of Berkeley. One of the things that came out to me was the fact that medication came out a lot today, and it seemed that there was like a push for medication, and I think certainly some people should receive medication for their mental health disorders. However, I think there needs to be an understanding of cultural consideration when it comes to medication, especially given the fact that a lot of people of color are in the prison system, and misdiagnosis is a major concern in the mental health field. And so there was no conversation about some of those things and some of those issues, like medication was the magic bullet.
Thank you. So join me in thanking this panel and thanking the folks from the criminal justice system for coming. Thank you.